Time for our visit with Dr. Kevin Kavanagh, retired physician and founder of Health Watch USA. Dr. K, good morning, sir.
Good morning, Jack.
I understand we are waiting the CDC's guidance on life guidelines for those who have received the vaccination. When does that due out?
Well, it's supposed to be due out any day now. In fact, a lot of us thought it would be due out last week. And needless to say, we will have lots to talk about once that comes out. But that answers questions such as if you had a vaccine, can you see your grandkids? Can two people who are vaccinated get together without a mask? Is it safer to eat indoors? All of that will be answered. And so we really do need to get what their opinions are. And it's not really easy to answer those questions because, as you know, they have to give those safety recommendations not based upon just the virus that we have, but also of the variants which are now looming and we may have to deal with in the next couple of weeks.
All right, well, that will be a biggie. Vaccine hesitancy fading in the United States, you think?
Yes, and that is good. And this is from a Paris marketing firm, IPSOS, and they found that we're gradually getting more and more people willing to receive the vaccine. Currently, according to Axos IPSOS poll, we have 57% of individuals in our country wanting to receive the vaccine. Now, mind you, Jack, that's still way too low, but this is heading in the right direction. I mean, this has jumped 27% in approximately 2 months, and I suspect it'll become a more and more larger number as more and more people realize this vaccine is safe. Because remember, we're constantly collecting safety data on those that have been vaccinated.
We've been hearing about these variants, and I understand the UK variant causing a huge surge in Europe, right?
Well, that's correct. And that's one of the reasons why we're hurrying up getting vaccinated. It's a real rush between us getting enough people vaccinated versus the infectivity of this UK variant. And no one knows how it's going to turn out. And so it is a real race. But one thing is for sure, if we do follow social guidance and we stay apart from one another at least 6 feet, we wear masks, that will put us on the winning track of not having a large surge. So I am very hopeful we'll continue to see a decrease in cases.
You know, one of the mysteries of the many mysteries about this whole situation are the people that they refer to as long haulers. They get the disease and then just they keep the symptoms for a long, long time. And now that's occurring in children, right?
Well, that's correct. Now, it's still not very common, but for example, Norton's Children's Hospital was covered in Kaiser Healthcare News, and they reported 25 patients having a range of symptoms which have occurred after getting COVID-19. And as you can remember, there was a lot of talk about the multisystem inflammatory syndrome, which can be dangerous, and that occurs, I would say, in about 1 out of every 1,000 children that gets COVID-19. So these are not very common, but they are serious. And needless to say, long hauler syndrome and the lasting effects of the virus are something that are going to become more and more of a concern, not only in children, but also in adults. So it's not just whether or not you die of the virus, it's whether or not you can return to a normal life.
Now, are there new drugs to treat COVID-19?
Well, there are getting some, and this is really good. One is called Molnupiravir. I probably slaughtered that name, but nevertheless, it is an antiviral drug which inhibits nucleic acid reproduction and reproduction of RNA viruses. And in an initial study of 202 patients, this was found to decrease the viral load of the patients and decrease their viral cultures. And that's really good news. There's also an antidepressant, which has been reported to really have antiviral activity called fluoxamine. And this drug, again, also had a decrease in viral symptoms and disease in those which were taking a drug. Small initial studies, in this case it was 152 patients, but both are very positive. Both, I believe, are going to have further study. And these drugs, because they are oral, they can be taken early on, and that I think is good because the sooner you get treated for this disease, the better. And that is, I think, one of the bigger problems with, for example, convalescent serum or for remdesivir is that oftentimes the drug has to be given late in the disease or it's not effective. These drugs, similar to Tamiflu, might be able to be given at the time you're in the office. So very good news, very hopeful. So we've got a lot of positive things, but let's continue to follow good public health advice so that we can get enough people vaccinated to take care of any potential threat from these variants.
Dr. Kevin Kavanagh, thank you so much.
All right. Thank you, Jack.